Well, welcome back, everyone. You know, sometimes we do struggle mentally, and, you know, minorities, everybody really does. But we've invited Tammie Colon. She's Executive Director of Mental Health and Recovery Services Board, and she's really going to be focusing today on minority mental health. So welcome, Tammie.
Thank you.
All right. So tell us all about this.
What's going on, right?
Yeah.
Yeah. So the month of July is Minority Mental Health Month. And again, as you say, we're all trying to manage what's going on in our lives today, but we also know that we have to be very intentional and aware that all that we do reaches all the people that we're responsible to serve, right? So we want to make sure that our messaging is said correctly, that it gets to the right people, that they understand their resources, and equally, that the behavioral health system understands all cultures and belief systems and can use the treatment modalities that we have to bring hope and help to people.
Yeah, I think that's important to realize that, especially within your own company, is to realize that people do struggle with different things. And you know, speaking of the minority mental health issues, it's been a long history of reasons why there would be mental health issues, correct?
Yeah, and a distrust for the system who has resources that could assist them, right? You know, there's a lot of, you know, family orientation among our communities of color. They have a tendency to rely on non-clinical, faith-based support, which is wonderful and very helpful, and we need to figure out how to partner with that so we can bring the treatment with it. You know, they experience things that most of the workforce, since it's mostly white, need to understand so that they can effectively treat them when they're in their office.
Yeah, that is very true. And then, you know, if somebody is struggling mentally, you know, your guys are always there to help, right?
We try.
Yeah, and it's I always say it's a wonderful thing that you are in our neighborhoods. Now, how does somebody go about, like, reaching out for your assistance?
Yeah, so, you know, we're in all schools. We have relationships with most faith-based communities, you know, businesses. So it is just telling somebody that you need to have that resource, and hopefully somebody knows. But the easiest way to ever get connected to what's available is through our 1-800-567-4673, our Hope line.
Yeah.
They're charged, and you could use the 211 system as well. They're both charged with compiling and ensuring that they have the resources to be able to manage a caller's needs and get them set in the right direction.
Yeah.
Should they be in a crisis, the We Care Regional Crisis Center on South Main Street is open 24/7 to receive people who are in immediate need of support.
Right. Just to give a little history lesson here real quick, because the Minority Health Month, you know, each July, it started with a lady, a woman named Campbell. Her last name is Campbell. And she really didn't shy away from any of the harsh realities, right? She was an author, she was an advocate, she was a trailblazer. She really did it all to create focus. And she ended up passing away, of course, you know, well, for the viewers that don't know, but she did pass away, but her legacy continues with this specific month, right?
Right. I mean, so often in our past, you know, there were cultures that were symptomatic and their behaviors were misunderstood, misdiagnosed, because people were unfamiliar with the cultures and the belief systems. And she brought an awareness to we can't treat everyone the same way.
Yeah.
And we can't say the same thing to every person, because how people receive it is based on their experience. And so she really did, you know, lead the way in making sure that we spoke to our communities of color to say, every community suffering from it, and it's okay to let someone know you're suffering. And to the treatment system to say, you got to be intentional. In your efforts.
Right, and I like the fact that you said that, you know, it was different. Nothing's copy-paste, right?
That's correct.
So every you know, different minority or not, man, woman, etc., they all have different ways that they might struggle or might need help.
Yeah, and they have different experiences that come with them through the front door. But it's very challenging when you walk into a treatment facility and nobody looks like you, nobody grew up like you, and so it is the professional's responsibility to be culturally aware in order to be able to help the individual. And so that's really why this month is important. It brings intention and focus to the whole system, to the people who need help, and to those of us who are helping
Well,
them.
Tammie, I appreciate everything that you do. You're always welcome to come back anytime.
Thank you. I appreciate it.
All right. Well, don't go away because medical news is coming up next.